welcome back to your very own health show, Health Mantra. Here at Health Mantra, we try to bring to you expert doctors from Manipal hospitals with their field of expertise to help you understand various health issues, try and prevent them, find them treatments. Today, I'd like to welcome Dr. Sabyasachi Mukhopadhyay. Dr. Sabyasachi is an interventional cardiologist with his field of expertise in angiography and angioplasty, echocardiography, pacemaker implants, device closures and clinical cardiology. Doctor, welcome to the show.
Thank you.
Now, when we say cardiology, of course, we are talking about heart and more specifically heart failure. I know when I say heart failure, most of us feel that, it's like, this is when your heart will stop functioning. It completely stops working. It's a death sentence, but no, it's not. There are treatments available, especially now more than ever. So what treatments are available? How do you prevent it? What are the causes? How do you know that you might be suffering or you might, have these issues in the future? Let's find out. So doctor, when I say heart failure, what exactly is heart failure?
Yeah, I'm glad you brought that point up. See, in colloquial terms, when we say heart failure, we mean exactly what you were saying, that the heart stops functioning totally. So it's not that way. When we doctors say heart failure, we mean a totally different entity from what we assume that you understand is to be a cardiac arrest. Cardiac arrest is when the heart stops functioning totally. Heart failure is a pump failure. Either it can be a pump failure in the sense that the heart is not pumping enough blood, or else the other aspect to the heart is that it is not relaxing enough to fill enough blood to pump. So the heart essentially has two phases. It relaxes and then it contracts. So the heart, when it contracts and pumps blood and it is unable to pump blood effectively, that is when we say that there is a pump failure. The other situation in which the heart fails to relax because of stiffness of the muscles, that is when we say that there is a diastolic heart failure. So these are two entities, and we shall be discussing both and exactly what to do and how to go about it and what needs to be done as a person who is part of our country, of our social fabric. What needs to be done so as to minimize, if you have got it, how to minimize its effects, and if you haven't got it, how not to get it, how to prevent it. So that is most important, and as they say, prevention is definitely better than cure.
And doctor, when you say heart failure, how am I likely to get it? What causes heart failure?
Yeah, there are many causes, and what they say is that in our country, there has been an estimated around 1% in the studies. But I feel from what I have been seeing over the last, I've been practicing since 1991, so almost like 30 years, 31 years. So the thing is that I have seen that maybe it is closer to the 5% mark rather than the 1% of the total population that is estimated in the studies. The causes of this are many. The most important causes are as for any other heart disease, that is one is this high cholesterol levels, the diabetes that is prevalent in our country, the blood pressure, high blood pressure that is prevalent, the tobacco abuse that is there, maybe not so much in Goa, but Goa is also catching up. But the rest of our country, actually there is a lot of tobacco abuse. And apart from this, the other causes that are there are sometimes this rheumatic heart disease, which has now actually gone down because of the extensive use of antibiotics and the rheumatic heart disease prevalence, surveillance programs that we have used. And from time to time, these people have been treated. So actually, what they say, especially for rheumatic heart disease, is that as and when our per capita income rises, the rheumatic heart disease shall decrease. But not so for the coronary artery disease, that is the ischemic heart disease. Ischemic heart disease, I'd like to tell you, is the major cause of heart failure in our country, and ischemic heart disease in India accounts for 60% of the burden of the world's heart disease. If you compare it in terms of population, we are contributing only about 14% of the world population, whereas we have 60% of the world's heart disease cases. So it's a very skewed kind of distribution that we have. It's a kind of biased this thing, and we have, probably because of our genetic predisposition to heart disease. So the other causes, apart from these main causes that we have, diabetes, blood pressure, tobacco, and this high cholesterol, the other causes that, because we have adapted a Western kind of lifestyle, especially in the urban areas, that is another factor which is adding to it. Stress. So stress and the disturbance of the circadian rhythm, the daily biorhythm that has been disturbed, that is what is causing a major problem in this heart episodes. Now another few miscellaneous causes are, yes, there are some causes like drug abuse. Drug abuse can also cause heart disease. Then there are some miscellaneous causes like sometimes of late I have seen a lot of people have gone out for trekking, either into the forest or into the high altitude, and they have suddenly landed up in heart failure. Now we are not very sure as to the cause of this, because they have all happened in very, very young patients, but I think there may be some viral component, some virus which may be involved in this. There are some viruses which attack particularly the heart, so maybe they are involved. We haven't done extensive studies into this, but in times to come, definitely we'll be focusing on that.
What about the treatment? Like, what are the newer modalities of treatments available?
Yes, see, initially if there is no outright failure, like I said, there are two types of heart failure. One is that the pump is not working effectively. Now, heart as a pump, because it is entirely made up of muscle, heart as a pump, pumps around 5 liters of blood every minute. Now, it does this with 55 to 80% efficiency. Means whatever blood is filling up in the left ventricle, which is the main pumping chamber, 55 to 80% of it is pumped out into the circulation, which supplies the various parts of the body. Now, this is the normal pumping efficiency, 55 to 80%. If it falls below this, that means there is some sort of pump failure, in the sense contraction failure. The other failure that is seen is that there is relaxation failure. Supposing the muscles become stiff due to whatever disease, and they become thick, and they are unable to relax, then the blood will not fill up inside the chamber, and consequently the blood will not be pumped out. Means less blood. If it fills up less, it will naturally pump less. So that is the other component, which is known as diastolic heart failure. It is estimated that almost say according to official estimates, it is 1%, but I would say around 5% of the population. Means almost our population is 138 crores. So you could say that maybe around 1.3 or maybe 2.6 or 4 crore population may be suffering from heart failure, out of which 70% would be around this pump failure, means contraction failure, and 30% would account for the relaxation failure. Now, every time we sit in the OPD, at least I have seen that almost around 20 to 30% cases, cardiac cases, whoever comes to our cardiology OPD, they come for this heart failure treatment. So this treatment, actually initially what we offer them is a combination of lifestyle changes like a little less salt intake. Then if there is a pump failure of a very severe degree, then even liquid intake has to be restricted. And the second point that we have is, apart from lifestyle changes, diet changes, is drugs. I mean, that means medicines. So there are a variety of medicines that we give, and along with that, the heart failure treatment, we also treat the other comorbid conditions like diabetes or blood pressure or heart disease like any blockage or something, or there is any kidney disease. So any other associated diseases are also treated and should be treated effectively for the heart failure to be managed effectively. Now there are some newer drugs which have come, which are actually essentially they were discovered for diabetes, but now since their role has been found to be very effective in heart failure, they have sometimes been used without diabetes also. The other things that we do are we put in some devices which improve the pumping efficiency of the heart. So there are various devices, and we have done we have implanted such devices even in Manipal. They are known as CRT. CRT stands for cardiac resynchronization therapy. So resynchronization means when the synchronicity of the walls of the heart, means they are not synchronized and they don't beat or pump together, then we need to synchronize them. So we put in some leads and we give electrical impulses, so they are synchronized together and they pump together, so that the pumping efficiency, which initially may have been around 30 to 35%, improves by around 10%. It goes up to 45%. Now what we are essentially doing is treating the effects of the disease. The cause also needs to be treated. If supposing there is a blockage in any one of those three arteries which supply the heart, that blockage also needs to be opened up. So that also, so there are two aspects to treatment. One is treating the cause of the disease, another is treating the effects of the disease. So what I said was, initially I was talking about treating the effects of the disease. Now I'm talking about treating the cause of the disease. The cause, essentially, if it is a blockage, it needs to be opened up so that more blood flows into the areas which are not receiving that much blood, and the symptoms naturally get alleviated.
So doctor, what are the symptoms, as in what are the alarm bells that certain symptoms that we are experiencing, maybe we might be suffering from heart failure? How do I know it?
Yeah, actually our assessment and treatment should start, like I said, prevention is better than cure. Our assessment should start even before the symptoms are actually kicking in. So symptoms are many, but the associated conditions which predispose are most important and should be identified and treated effectively at the earliest. So these conditions are, as we all know, diabetes or high blood pressure or kidney disease or rheumatic heart disease or ischemic heart disease, or like tobacco abuse. Obviously it has to be cut off totally. There is nothing like, I have a lot of patients who come and tell me that I have cut down. Cut down doesn't mean anything. You have to totally stop. And in fact, I'd like to tell everybody that if you stop smoking and stop tobacco abuse for at least 2 years, then only your risk equalizes to that of a non-smoker. So 2 years, absolutely no smoking, no tobacco, then only the system gets cleared out, and this has been proven in a study. So this is one, and the symptoms that actually come up are the usual symptoms, that is breathlessness. The other symptoms are easy fatigability, means you get tired very easily. And the third symptom, even before breathlessness comes during the daytime, is breathlessness at night. We call it PND. Means suddenly the person has to wake up in the middle of the night and he feels breathless, and he has to rush to the nearest window, or he has to sit up to, feel okay, that okay, now I am feeling that, there's enough air entering my lungs. So while lying down, after lying down for a few hours, then suddenly the lungs get filled up, and a person wakes up or sits up, and then he feels better and then goes to sleep. The other, another condition which I did not mention earlier is OSA, that is obstructive sleep apnea. What happens in this condition is this is associated a lot with obesity. What happens in this condition is that the air which should be entering the lungs gets somehow, it does not enter the lungs because the airway gets blocked. The airway, the path of the air entering the lungs gets blocked because there may be tissues from both sides which are blocking it. All the tongue is falling back. So this is a very important condition, and it needs to be recognized and investigated. The investigation for this is known as a sleep study. So we have that in Manipal, and I have referred a lot of patients to the chest physician who does this study and who tells us that whether the patient is, getting this lack of air that is known as apnea spells during the course of his sleep. And this later may be a harbinger of telling us that this person will have diabetes or blood pressure or heart disease later. So even if the person has not got, then OSA tells us that yes, later he may get one of these diseases. So OSA should also be recognized and treated. Now the other, some of the other symptoms are like chest pain or like cough. So these are some of the symptoms that we have. I'll go over them again. One is breathlessness, or when you're feeling short of breath. Nighttime breathlessness, that is when you're lying down on the bed and after a couple of hours you're feeling breathless. Then easy tiredness, that is easy fatigability. Then you have chest pain, and then you have cough, sometimes even palpitation. So palpitation also, that means there is, it literally means that you are aware of your heartbeat. So if you are literally aware of your heartbeat, something is going wrong, so you need to get a checkup. So best is to go for a checkup as early as possible. Another point that I'd like to make at this juncture is that heart attacks, not all of them are symptomatic. So 25%, this is proven in the studies again, 25% of all heart attacks are silent. So we need to be careful. That is why all the risk factors, all those diseases, comorbid conditions, they should be treated effectively at the earliest. Sometimes we find a lot of patients coming in for checkup, and we find that they have had a heart attack sometime in the past on the basis of their ECG or echo, or sometimes even angiogram needs to be done to prove. But yes, Indians are most prone to heart disease. So I must again and again re-emphasize that please get yourself checked. And we are getting this heart disease 10 years earlier than our European or even our Japanese counterparts. They are supposedly healthier than us. No, I'm not talking about the Chinese. The Chinese have a lot of strokes and brain disease, because they apart from having diabetes, they also have a lot of tobacco abuse. Like us, we have a lot of tobacco abuse in this country, and we need to actually stop that. Alcohol is another under recognized cause of heart or pump failure, because alcohol directly affects the muscles. So it causes alcoholic cardiomyopathy. We have seen a lot of alcoholic cardiomyopathy, and it is high time that we should be aware that alcohol, as everybody says alcohol is good for the heart. No, it's not good for the heart. It may not cause blockages, but it does not help in the pumping. It does not help in the pumping one bit. So this is, again, I want to emphasize this point. Alcohol, please do not go around spreading this message that alcohol is good for the heart. No, it is not good for the heart.
And doctor, one more thing, I just, the way you mentioned about this night breathlessness, it also happens in some asthma patients. So how do I not get it confused if at all I'm suffering from the same?
Yes, that is a very good question. Now, there is a famous saying that, in our physician and cardiology and chest physician circles, that goes by the saying that all that wheezes is not asthma. Okay, it's similar to that saying all that glitters is not gold. So, all that wheezes is not asthma, means saying that all the time if the person is wheezing, and initially we have this habit of denial. It's a normal human tendency that whenever we fall ill, we say that, okay, no, it cannot be me. So that is the thing we need to get rid of, and we need to check our bodies, get our bodies checked, get our systems checked by the best possible person of that field, like we do for our vehicles. I've seen, Goans are very, passionate about their cars and bikes and all. It's like the Parsis. I was born and brought up in Jamshedpur, so I've seen a lot of Parsis, and they're also the same. They are very passionate about their, vehicles, cars and bikes. So, like they get their, bikes and cars checked by the best possible mechanic, we should also do the same, and in Goa we should get ourselves checked by the best possible person in that particular field, be it the lungs or be it this thing. And whenever you have any doubt as to whether this is related to the lungs or the heart, best thing is to come for a checkup and get it checked by both the chest physician, that is the lung specialist, and the cardiologist, so that all doubts are cleared. So we can proceed in one particular direction. And even actually a long-standing case of lung disease can cause right-sided heart failure. We call that cor pulmonale, heart disease due to the lungs. So that also we have seen, and that happens due to lung disease and the rise in pressure inside the lungs. So this also is another entity of heart failure.
And doctor, are there any precautions in a way that we can prevent heart failure?
Yes, actually this is a thing which can be answered both at the population and the higher or public perspective, as well as the individual level. Now the public level, what we need to do is we need to detect more and more comorbid or associated conditions like atherosclerotic heart disease, or your OSA that I was talking about, obstructive sleep apnea, or obesity, or high blood pressure, or high cholesterol levels, or diabetes. All these things need to be identified and treated early, so that the person does not go into heart failure. And the second thing is, if any person has already got this coronary artery disease, so as not to go into heart failure, it needs again to be treated very, very effectively. And if the person has already gone into heart failure, there are various modes available. Like I said, initially lifestyle changes, diet changes, then medicines, then devices, and of course ultimately there is of course there is a component of we can go in for heart transplant, but that is in the extreme cases. That rarely we need to go into, if effective treatment is available both at the community level and at the personal level, I think we can really take care and not let any person become morbid. See, I am not anybody to prevent death. In fact, no doctor has ever prevented any death. We are here for as long as we are. We do not know when, nobody knows when anybody is going to be born or when anybody is going to die. But yes, till that time when we are here to support each other. And the way to support each other is, I am supporting a patient, maybe more medicine wise, professionally, and a little bit of social support. But the other persons in the society also have a role to play. They also need to support the other person, as well as social as well as any other way they can, especially by increasing awareness. Now, one thing I'd like to say is that yes, in Goa we have good treatment options available, and even at any level, even in the primary health level, they are doing good work. And the only thing is, you have to, from time to time, everyone has to consult a specialist, because this heart disease is so prevalent that we need to consult a specialist, so as to know whether the person is varying from baseline, going into some sort of failure, and before that happens, we need to take some corrective action, like diet and lifestyle changes, like medicine, minor corrections and adjustments need to be done, and basically making the patient aware that whenever he needs help, we are there for the patients.
Thank you so much, doctor.
Thank
I really
you.
hope that today's episode helps our viewers understand and diagnose heart failure.
Thank you. Thank you for calling me. I'm really honored to be part of this show, and I'm glad that I am able to reach out to the audience and make them aware that yes, effective evaluation, effective identification and effective treatment is available. But yes, you need to come to the doctor, you need to come to the specialist. Please do not hesitate. There is no stigma attached to it, nothing and we are not here to go through a battery of extensive tests. We will do some very minimal tests, we will do some very basic evaluation, and we will help you to the best of our ability. Thank you. Namaskar.
Those of you who wish to consult Dr. Sabyasachi Mukhopadhyay, he is available at Manipal hospitals from Mondays till Saturdays.